unconsciously tends to create a balance between the sympathetic and parasympathetic components of autonomic nervous system. Once the emotions that accompanied an experience or a series of experiences are completely discharged, now this is important, completely discharged, there is a spontaneous change in thinking, behavior, and perception towards that experience or similar experiences. Emotions can be discharged in many ways. Stimulating the autonomic nervous system in a controlled, flexible manner can help attain desired results. Using breathing exercises to chip away chronic cumulative stress, a foundation is laid for processing of bottled up emotions of grief, anger, and trauma. Using images of memory of traumatic experiences, and that's the raw material for our work. Memory of traumatic experiences, the person is desensitized against their traumatic experiences. 3 key areas of trauma in each history: unresolved grief, unresolved trauma, and unresolved anger issues. Using psychotropic drugs, we can numb the emotional arousal, which we do, and that's why we use psychotropic drugs. Reducing medication, we can recreate emotional arousal. Because the sympathetic, you have taken the lid off the sympathetic tension. With meditation, we can increase emotional arousal. I've seen people who have been stable on medication, who are schizophrenic, and you ask them to do meditation and they become psychotic, and the medication is still there. That's the reason why. With imagery, we can process the emotions associated with emotional arousal. The goal of therapy is to help a patient become independent with minimum medication, using only meditation as a maintenance treatment. Case history. 32-year-old married father of 3 children. Complaining of work stress, irritation, inability to relax for 10 years. He was caught by the police when he called a 10-year-old unknown girl for directions as he was masturbating in his car. This was his first brush with the law. Police were contacted. There was no past psychiatric history, no forensic history. Mother had died many years ago. He was angry with his older violent brother and his father, who had deserted the family. There was a trauma of a road traffic accident, fear of swimming because of a traumatic event while swimming many years ago. Outcome with the work that we did in 12 sessions, again an exceptional case I would say, learned how to relax, outlook towards life has changed. This is a very old case actually. 32-year-old female single teacher living with her wheelchair-bound mother for 7 years, loss of hair due to work stress for 11 months. She was prescribed fluoxetine by her GP, she did not take that. The stress factors were death of her father 7 years ago and a friend 4 years ago. Ongoing trauma of looking after her mother, all waking, non-working hours. Outcome with subjective emotive grief therapy, hair loss stopped, work became stress-free, and she got a promotion at work. Wisdom of ages in the end. Tao Te Ching says, what is going to be diminished must first be allowed to inflate. Whatever you want to weaken must be convinced of its strength. What you want to overcome, you must first of all submit to. Thank you.
Dr. Chadda from Ireland, very nicely detailed presentation. Stress, emotion, the psychopathology of emotions, stress. Myself heard first time this detail. Dr. Chadda, I also worked in London for 2 years in St. George's Medical School and attended few lectures in Maudsley Institute of Psychiatry, 1980-81. I was working in Department of Adult Psychiatry and working with St. John Cobb, analyzing marks, working on behavioral psychotherapy. Dr. Chadda has explained very simplified way. I think this is the same as rational emotive therapy of values.
No,
This is different.
No, this is my own. This is my own
This is
term.
your own,
This is my
very
own
nice. This
word.
is your own. What is the main thing that I have seen many years in our country? People are using more drugs. If patient comes of anxiety, post-traumatic disorder, or any stressful situation, because lack of time or ignorance, they prescribe drugs. Drugs, what drugs will do? Subside symptoms for a short time. But what happens unless you don't go to detailed analysis, stress, how they stress, the whole short behavior history, then you can find out, give some psychotherapy. If anxiety, depression, stress, do the relaxation therapy. You can do the behavior therapy. The cognitive therapy is very important. Cognitive behavior therapy. Like this, what I have seen that as such psychotherapy is very less developed in India. Students teachers teach very less in psychotherapy. More of stress on the drugs and other means of treatment is taken. But the psychotherapy is a very important role in treatment of depression, anxiety, stress situation, many things. Anyway, I am very much impressed by Chadda to learn the stress management, the trauma. Very nice.
Thank you, sir. I'm no worries.
Thank you. Anybody wants to ask any question to him? He'll be ready to answer.
Yes, sir.
Definitely your presentation was very stimulating, very interesting, but just wanted to ask you one thing, that there are different stages for integrations in BPAD or any blood integrations of the leukemia. So when and what time these kind of therapies will be more effective?
Well, the first thing is that it's not an emergency medicine.
Yeah, that's true.
So if you have someone who is violent or who is manic, they will definitely need medication. But once they're stable, once they're settled down, then the time comes to maintain them. And that's where this therapy can come in. But as is usual with all therapies, it is the person who is suffering who needs to work. And it's they who need to realize that they can help themselves. The problem is, I've seen it in the Western world anyway, the problem is that because the whole system of healthcare is state funded, when a patient comes into the service, they go away with the impression that it's only the doctors in the system that can treat them. And that's very sad because they take away the impression that they are helpless and they have to depend on doctors and therapies to help them. If you look at what I have stated, the end point is usually, I ask a person to take away 30 minutes, half an hour of meditation by the time they finish with me. And they do that for the rest of their lives. And that's all. That's their maintenance medication.
But here, sir, in India, actually, whether you are doing the cognitive behavioral therapy or psychodynamic therapy, the problem is that even with the so-called educated persons, they will not have the patience to go through all the therapy, to attend the therapy sessions as given. Dropouts are there when they are in a lot of distress.
Naturally.
Then they will be forced to come to the
Naturally.
therapies. But when the things will be improved, then gradually they will again winning up.
Yeah.
So it's very difficult to keep track of that and then keep on motivating them to attend the therapy. Like in subjective neural group therapy, the number of sessions what is required, or in other therapies the number of sessions what is required, but still the persons will not be able to attend in our clientele or particularly in our
For that, what I do basically, the principle of my work is that whenever a person comes in, I know they are highly stressed. I know they don't have time to do anything. I give them an exercise for 3 minutes, a breathing exercise for 3 minutes. And this I do as a rule of the thumb. And I tell them, if you can't do 3 minutes of the exercise I'm going to give you, you shouldn't be here. So I'm in private practice. It's very rare that someone drops out. But you start with 3 minutes and then build on it.
I think he has adopted his own method of dealing with them. And you have to see whether here in this setting, in your cultural setting, our setting, what barriers are there, how to remove them, how to make them, there are people who are practicing psychotherapy and we have practice, people come. You first have to believe in yourself that you are going to do this therapy, you believe in that therapy, and your belief also matters. If you have yourself very shaky and you feel whether this fellow will, and then the patient perceives somehow and he will not be better.
40% of the outcome of therapy depends on the patient. 30% on the relationship between the patient and the therapist. And the rest of the 30% is the technique or whatever.
Right. Okay.
Rather than in private, they are paying money, so they will value for the outcome.
Yeah.
But here in the government setup, they are not paying the
Right.
money. So that seriousness, I agree with you, sir. It's also depend upon us that how much
Yes.
we are motivated and
Right.
we are able to hold that folk together.
Right.
But in the government setup, because of lack of time, lack of the professionals, because he knows that obviously we are able to use this 30 minutes or 45 minutes. So that matters.
Yes, sir.
Sir, after 3 minutes of therapy, do you go for relaxation therapy or?
No, it's not 3 minutes of therapy.
3 minutes of
3
breathing.
minutes homework. They do homework.
They do.
Okay. There are two kinds of breathing that I ask them to do. In the first stage, I do the sympathetic kind of. The sympathetic breathing is they will take a deep breath in, fill their lungs with air, and then breathe out, making this sound. So if you look at it, the chest is tensed up, the throat is tensed up, so it's a sympathetic activity, and the person is breathing. So you are stretching the sympathetic system to its peak, and then it starts to fall. And we are dealing with accumulative stress. So if a person does this thing for 3 minutes every day, you will see yourself, if you are practicing any form of psychiatry, including medical prescriptions, if you give a person an exercise for 3 minutes a day, and if they can do it for weeks and months, you will yourself see a change in them without any change in medication. This is one form I do, but once they are used to that, then I ask them to do the passive kind of breathing. Not constricting their throat, not constricting their chest. Take a deep breath in and breathe out passively. Again for 3 minutes. Now that's a sympathetic, parasympathetic breathing. So this is the mechanism that I use. So it's a jugglery. Sympathetic, parasympathetic, sympathetic, parasympathetic.
My question is whether do you incorporate JPM also?
Sorry?
Relaxation.
Jacobson
Jacobson's relaxation.
No.
That is progressive, Jacobson's progressive muscular relaxation.
That's right. You see, my objective of developing this work has always been to make it simpler. And using common sense. This is all common sense. I mean, I've learned it firsthand. I came from a medical background and just started to wonder what was happening.
Yeah.
I've never attended any psychotherapy college other than learned hypnosis. That's it.